Hello, greetings. Okay, welcome to today's discussion with Miss Sandis Namba, your go-to radical RN tutor. Okay, in our discussion for today, we're going to talk about diabetes mellitus. Yes, okay, so allow me to start with the definition of diabetes mellitus. How do we define this condition? Okay, so in my definition, I'm saying that diabetes mellitus, basically this is nothing but a chronic metabolic condition in which there is a disturbance in the metabolism of carbohydrates, proteins, and also fats. Of course, due to defects in insulin action or secretion. And it is mainly characterized by dry skin and also polyuria. Yes, that's a definition of diabetes mellitus. Okay, so diabetes mellitus, it comes as a result of the body's inability to regulate the sugar levels, leading to a state of hyperglycemia, meaning an extreme elevation of sugars or glucose in the blood. Okay? So for the sugar levels to be regulated, we need a normal functioning organ known as the pancreas. So this pancreas, it is of course located in the left upper quadrant in the abdominal cavity. Okay? Yes. So this is a simple structure of the pancreas. The pancreas is divided in three. We have the head, the body, and also the tail. Okay? This pancreas, it has clusters of cells, which we call the isolates of Langerhans. So these are isolates of Langerhans. Yes. So each isolate of Langerhans has 4 different types of cells. Okay? Each isolate of Langerhans has 4 different types of cells. We have this cell here, which is a beta cell. We have this cell here, which is an alpha cell. We have this cell here, which is the delta. We have this cell here, which is the PP cell. Okay? So each of these 4 cells that are listed has its role or function that it does what it plays. It has a specific role or function it plays. Okay? So the beta cell, this cell here, it produces insulin. Alpha cell produces glucagon. This cell here, it regulates beta and alpha. The PP cell regulates the production of pancreatic secretions. Yes, and it is also very important to note that this organ, the pancreas, it has both endocrine and exocrine function. Yes. Okay, so if in our body system we have sugar, increased sugar levels here, okay, this pancreas will produce insulin. Okay, so this insulin, it acts more like a key, meaning that it unlocks the cell. Okay, it unlocks these cells so that this glucose could enter the cells. Okay, that's how this insulin works. Okay, when we are starving, the pancreas secretes glucagon. Okay, so this glucagon, it is there to break down the stored glucose. Of course, glucose is stored in forms of fats, which we call glycogen. Okay, so when we are starving, the stored fats or glycogen, it is broken down to what? To glucose, so that we have enough what? Energy. Okay? So now, what really happens in diabetes mellitus is that the pancreas cannot produce this insulin, or the cells have gained resistance to the action of what? Insulin. You find that the insulin is being produced by the pancreas, but these cells, they are not responding to this what? Insulin which is being produced. Okay? Or the pancreas cannot produce insulin at all. Okay? Of course, that can come as a result of some autoimmune conditions. Yes. Okay. So now, let us talk about the classifications of diabetes mellitus. I'm sure we're going to understand more about the insulin in the classifications of what? Of diabetes. Yes. Okay. So diabetes mellitus is classified in two. Okay. We have two classifications. The first one is type 1. Okay. The first type of diabetes is type 1 diabetes. Okay. So in type 1 diabetes, this one it is sometimes known as insulin dependent diabetes mellitus. Okay, why is it called insulin dependent diabetes mellitus? Well, the reason why it is called that is the fact that the pancreas cannot produce enough insulin, okay, in order to regulate the sugar levels in the blood. Okay? Yes. So in type 1 diabetes, there is no or little production of what? Of insulin by the beta cells. Okay? Yes. Mainly, type 1 diabetes mellitus, it is associated with autoimmune conditions. When we talk about autoimmune conditions, we are simply saying the body's immune system starts attacking what? The beta cells or the same pancreas. Okay? So once the pancreas has been attacked, it basically means that the beta cells have also been attacked, and they'll fail to perform their normal metabolic function of insulin secretion. Okay? And that will bring about low or no insulin in secretion. And that will bring about an elevation in the blood glucose levels, leading to a state of hyperglycemia. Okay? Yes. Mainly type 1 diabetes, it doesn't run in families. Yes. It doesn't run in families mainly. Okay? Yes. Before it was called insulin dependent, we also had another name which we call juvenile onset diabetes. So it was called juvenile onset diabetes because mainly the symptoms, they appeared before the age of 30. Okay? Yes. Okay. Then the other type, diabetes mellitus, is type 2. Okay? Type 2 diabetes mellitus. So what about type 2 diabetes mellitus? So in type 2 diabetes mellitus, we have a normal functioning pancreas. Okay? The pancreas is able to produce enough insulin. But unfortunately, these cells, they have gained resistance to the action of insulin. Okay? These cells, they do not respond to insulin action. Okay? Yes. So that basically means that even if we have enough insulin here, this cell, it is failing to open for this glucose to enter the cell. Okay? This is what happens in type 2 diabetes. Okay? The other thing that we have to take note is the fact that type 2 diabetes, it also has a genetic history, meaning that it has a tendency of running in families. And mainly it occurs or it affects people that are over the age of 30. Yes. Okay, so this is about the two classifications of diabetes mellitus. Okay, now what could be the predisposing factors? What can lead to a person to develop this condition? Okay, we have so many predisposing factors. One of them is diet. We can talk about age, obesity, genetics, cortisol, pancreatitis. We can also talk about autoimmune. Yes, these are some of the predisposing factors, things that may lead to a person developing diabetes mellitus. Okay? How about the clinical features? How can we tell that this person has diabetes? Okay? We can talk about we can talk about polyuria. We can talk about polydipsia. We can talk about polyphagia. Dry skin, and also glucosuria. Yes, so these are some of the clinical features that a patient with diabetes mellitus is likely to have. Okay? Yes. Then the other key thing that we have to know on the management is that each type of diabetes, it has its own management. Okay? In type 1 diabetes, due to the fact that the pancreas cannot produce insulin, it is highly recommended that we treat it using insulin. Okay? We have to administer insulin. Because the pancreas is unable to produce insulin, we have to talk about giving insulin. Okay? Yes, so we can either give long-acting, short-acting, or immediate action, acting insulin, depending with how the patient responds. Okay? And also depending with how high the sugar levels are. Okay? Yes. We can also manage this type by also giving fluids such as normal saline. Okay? Yes. When it comes to type 2 diabetes, mainly type 2 diabetes, it is managed by giving oral hypoglycemic agents such as glibenclamide and also metformin. Okay? Yes. So those are the two drugs that are mainly used in the management of type 2 diabetes mellitus. Okay, how about the complications? What are some of the things that could come as a result of diabetes mellitus? Okay, we can talk about retinopathy, we can talk about cardiomyopathy, we can talk about neuropathy, we can talk about nephropathy, we can also talk about CVA or stroke. Yes. So those are some of the complications that may come as a result of failure to control the sugar levels in the circulation. Yes. So this is what I had for you on diabetes mellitus. Okay? For any questions, please ask in the comments section. Thank you.